and we hope to continue after the COVID our strong relationship with the United Nations Joint Inspection Unit. Well, that was one of the massive conference where academia, ourselves, United Nations, all agencies came, WHO, UNIDO, all of them, plus private sector. We had the private sector in Geneva, plus civil societies. And the conference had to go for 4 days. And still we haven't been able to manage to get all people. And then in 2019, our last face-to-face conference was also hosted by the UN International Maritime Organization. So we will continue to do that, and we would like to be engaged with government, all international organizations across the world. I will hand over now to the chair, to the moderator, Professor Gonca. The floor is yours.
Thank you. I would like to welcome everyone to the last session of the conference. In this session, speakers will be sharing with us their expert opinions. Thank you for being here. And speakers have 15 minutes for their presentations. The first speaker of this session is Professor Midion Mapfumo Chidzonga. He is a respected senior academician in the University of Zimbabwe, and he was the first dean of the and now thriving dental school. His specialty is maxillofacial and oral surgery. He also has a higher qualification in education and public health. Please, the floor is yours.
Right. Basically, my presentation is based on COVID-19 pandemic, the inequity, equity, and iniquity involved in the pandemic, COVID-19 pandemic. Basically, we all know that coronavirus disease, the cause of the COVID-19 pandemic was caused by the SARS-CoV-2. So when we talk of the inequity of what is caused by the pandemic, there's global disruptions in the economy, social, and education. And so the inequity is that it has actually overwhelmed health facilities in most countries, the developed countries and the low middle income countries. Next slide, please. And also particularly the low income and middle countries have been heavily affected because in all this time, their health facilities are under strain because of the common diseases that are common in our environment. And of course, the economy, the little economy that was about to thrive has also been hard hit by the closure of businesses. And most of our economy has been involved in tourism. And of course, the closure of the travel bans, which was necessitated by the COVID-19 pandemic, has led into actually a virtual collapse of the economies. And of course, the unemployment. When you bring in the issues of lockdown, you find that most schools, universities, businesses had to close down again, which led to very difficult situations. The education system is also strained, and the lockdown has not helped in any way. And of course, the social distancing has been very difficult to implement in view of the fact that most of our communities, particularly in the urban areas, are crowded, and even the transportation system is crowded, which made it very, very difficult. And also came the issue of vaccines. The low and middle income countries are the last to receive vaccines, and most of the vaccines we have been accessing have also been donated by other countries. And of course, we could not access the other markets in the high income countries. As you all know, the inequity involved by the hoarding, most of the countries are hoarding. You know, they're now moving into the third vaccine, when Africa, most of the countries actually have not even started the first vaccination. And of course, there's also limited access due to the unavailability of the vaccines. Next slide, please. And of course, we said Africa is still struggling with the administration of the first dose, and of course, with also the misinformation about the effects of vaccines on our communities. People are resisting, and of course, the myths that some of these vaccines are meant to exterminate people from the third world. And of course, our countries themselves, they're indebted with the expense of buying vaccines, they're not able. So that's where the equity, the WHO and AU have tried their level best to access the vaccines to these poor countries, but unfortunately, they're meeting with resistance, as most of the vaccines have been bought well in advance by the rich countries. Currently, most of the countries in the poor countries, particularly Africa, are relying on donors like Russia, China, etc. And of course, most of these vaccines are being actually derogated by the Western countries, and equitable distribution has not been possible, such that most of these countries are left behind. And of course, even the protector, the PPEs, again, they're in short supplies, and most short countries have now started preparing their own PPEs. And of course, the vaccines, we're still a long way off from preparing our own vaccines. And I believe that's the route to go. Africa we have the expertise, but we do not have the infrastructure. So poor countries must be encouraged to spend most of their monies, at least a reasonable amount of their money, in acquiring the infrastructure to develop our own economy and also develop our own expertise. Most of our experts are outside the countries and actually doing wonders there, but of course our countries cannot afford it. We mentioned that education has been disrupted. Again, our education has been below par, and also this COVID has meant further deterioration in our education system. And of course, we're ill prepared for the pandemic, mainly because of our health systems. Next slide, please. Next slide. So most education institutions are struggling to implement the online teaching because of the poor infrastructure. And of course, some of the online teaching facilities require expensive equipment, which the countries are finding difficulty in acquiring. Most of the online teaching is done on a rudimentary position, and the inequity involved is clearly shown by the Omicron virus, which some countries in the West are calling it the African virus, which is most unfortunate. The fact that South Africa was the first to announce the detection of this virus, it has placed the plague on Southern Africa. As you are well aware, the Southern African countries, almost all Southern African countries, were the first to be banned for travel abroad or for visitors coming in, which we rely on as far as our tourism is concerned. But of course, they were still coming for our wealth. The scientists who discovered, or at least who publicized the Omicron virus, believe they are being penalized for sharing their scientific information. And yet, the current spread of Omicron virus in, say, Europe in particular, was found actually most of those persons had never traveled to our region, but our region is now being blamed for possible transmission of the virus. Again, that's the iniquity of the COVID-19 pandemic. And of course, there's the criteria for travel ban has been discriminatory. Only specific countries, poor countries, have been targeted. Yet within the rich countries, people with Omicron virus have not been banned from travel between their countries. Next slide, please. I mentioned earlier on that most of our scientists have left the countries mainly because we have poor science infrastructure, which I believe can be rebuilt, and we should be able to compete with the rest of the world. And I think this is the way to go, all the poor countries to develop the health system, have the right infrastructure, and then we should be able to compete with the rest of the world in preparing of vaccines. And of course, our education system will also be improved. Again, we need to start building self-sufficiency. I think that's all. Next slide, please. Thank you very much. Thank you very much. Thank you.
Thank you. Thank you, Professor. Today, our next speaker is Professor Farida Fortune from Queen Mary, University of London. She's graduated both dentistry and medicine. She is Professor of Medicine in relation to oral health in the Center of Clinical and Diagnostic Oral Sciences. And she is also hosted the conference with Professor Alam. Please, the floor is yours, Professor Fortune. And sorry, the title of the presentation, I'm sorry, is the knowledge environment. Please, the floor is yours.
Hello, thank you for asking me to talk today, and thank you, Prof. Alam. I absolutely enjoy and adore working for you. So, as I'm going to talk about the knowledge environment, whether we always have the new or does sometimes the old have quite a lot to teach us. I'm going to try and use mine. Okay, so this is us, and we're not alone, neither inside of us or outside of us. And I think we always act here as though we are. So we have an interaction with our environment, both internally and externally, and our cultural and environmental, as well as our genetics, will actually determine our lives, and what we do with it will determine the lives of everything and everyone around us. Next slide. Okay, so I'm really passionate about the sustainable goals, and I think we have a good global engagement strategy with WASD. We also need to have education and health strategies, and as Prof. Chidzonga said, it's really important that, you know, people have ownership. So when things like COVID happens, that although it's global, locally it can be implemented. World-class education research, working with industry is important, and policy partnerships. So I'm very keen on governance issues. We have a global society, and as today, we have a really good community of friends. We really have to embed it in policy and governance. And as John Buchanan said yesterday, that, you know, you have an audit cycle where this is looked at constantly. So education and health strategy, we cannot actually work in isolation. We have to work together, whether you're in medicine or engineering or in a policy institute or in a history. We all have something to contribute, as well as you can't work in health by having one specialty or having a generalist. All have to work together. That way you can innovate and you can work with industry with good outcomes. However, I think we've all forgotten our work has to be complemented with local and traditional communities because they have ownership of health. So here's a wedding cake image, and it's the hierarchy of dependence. You saw this yesterday, and it just shows you how society as a whole, locally and globally, are all interconnected. Next slide. Okay, so how does the environment, health, and education, how do we make better health for all? So I talk about our local community is in the East End, but you could see you need to have health provision and take into account your environment, your evolutionary biology, which is your genetics, inside of your human microbiome, and as we spoke today, the psychosocial impacts from environment and to environment. So I think we should start working using anthropogenic structures, looking at health outcomes. As I said, it's interdisciplinary. So in our university, we are looking between the medical school, the hospitals, the university, and the policy institutes. Innovation, you know, everyone can innovate, and it's not the domain of the few experts. Next slide. So for better health for all, which again I'm passionate about, you cannot look at one age group. You cannot look at the young. So people will do pediatrics or do aging, and you forget what's in between. So the life cycle is from birth to death. And as I said, if you have this anthropogenic model, you'll see the genetic impact, the impact of drugs, your metabolism, mental and oral health, how interdisciplinary working across universities, not just in your own country, not just in your own city, but globally. And this is a really good forum to do that. We forget that there's frailty. So you might, if you're in a developing country, have frailty when you get to quite an old age. But actually, frailty occurs from birth. So if you're in a country without resources, your frailty profile is already going to infect you during gestation. Next slide. So I'm sure you've all seen this. This is my framework. I always have it up because Professor Adil, you must have governance and policy, right? So you cannot do anything if you don't have a governance framework. And this is one of the programs I work through. It's satellite connections, where we have a global network which feeds out to local communities, hospitals, universities, and local community part of this is very important, because when you don't have broadband, if you don't have internet, good satellite connection might help. And could I say to people in Africa, look at your satellites. There's huge amounts of satellites all over Africa, which have been mothballed, which could be taken out and used and make Africa really a lot more independent. Next slide. Okay, so what do we do with crisis? We must have a crisis management plan. There needs to be a task force. This can be at a government level, but you must have a local plan. So what do you do if you're sitting in a small town in South Africa, or you're sitting in London? What do you do when there's a crisis, which we've all had, totally unforeseen, descended on us? Were we prepared? Was there planning? Do we have response? How do we build resistance into our systems? We can no longer say we don't have the money to do that. It has to be in place. So if you take here in London, through my university and the hospital and the medical school, really it's working across all sectors, national agencies and charities. And I also think that the international charities, a lot of countries should feed into that. Embedded in your education system, embedded in your health, embedded in everything, and try and innovate. You know, when it happens, you can't do anything about it. If you've had planning, you can. Next slide. So this COVID descended on us, and there was loads of plans nationally. The UK had a plan put in place in 2016. There was plans through the university, plans through the hospital. But we have a very diverse community, 49 languages spoken just in our hospital. And we had a lot of vaccine mistrust, misunderstanding. As everyone knows, the internet was a real nightmare. So we worked under the radar, which I think is also really important. It's your community. What do you need? We don't understand what everyone is saying. We made posters in 19 languages. And we got local people to take copies and put it in their shops, in their butchers, in their pharmacies. And we made a waterless soap available to a lot of countries who couldn't afford. And where we couldn't, we sent the recipe abroad. We didn't think anything would happen of this because it was so local. But then one day I was watching the BBC News and I saw our poster in Glasgow, and they were saying localism is the only thing that works. Next slide, please. So how do we innovate and make commercial partnerships? Now, we are a huge organization, WASTI, and I work with other outside organizations as well, not only through the universities, but if you harness the universities, the big organizations like this, the diaspora, we can make a huge, huge difference. And then there's innovation in therapies. Use your local community. They have actually a lot to contribute. I think people don't realize that the Americans used to send scouting parties across Africa, and a lot of the drugs that are available came from local communities sharing their information. Next slide. Okay, so you can go from East London nationally and globally, but actually you can go from Kimberley, you can go from Istanbul, you can go from Mongolia and do something locally, all right? We've got big enough groups to make a difference with lifelong learning, with innovation. Work together with crisis prevention. Not everyone knows, okay, those who have expertise help. And then look at your environment and health systems and how that could also contribute. Next slide, please. Okay, so I'd like to stress that the knowledge management has to be defined by local people. So my thing is, think globally, implement locally. Local people, the only way it's going to be sustainable is if local people are allowed to have ownership of both the knowledge and the leadership. And I think if you listen to Prof. Chidzonga, it's actually saying, you know, Africa is such a huge resource. We have to start taking ownership, exactly like India did. And I think, you know, it's the largest continent. You know, the maps are all wrong. However, you have to have better communication. You've got to have better electricity. You can't have outages all the time. You can't be spending 10 times the amount of your salary on electricity in a small township than I spend on my electricity in London. Those infrastructures have to be sorted out so that communication could be a lot better. Next slide. Having done all of that is actually, we don't know very much, right? Look at, in the top slide of the slide there, that is Matera in Italy. I went there, I was just blown away. It's a cave town, so sophisticated, you would not believe it. 40 years ago, the Italian government moved everyone out. But what a resource. You're going there and it's like 38 degrees outside, 2 floors down, equitable temperature, brilliant. Now, international hotels are moving in to utilize the area. We lived very well. We lived with environment. And look at Matata as well in Tunisia. People are now moving out. But again, it looks like holes in the earth, but it is sophisticated living conditions. Should we be thinking of those again? My friend from Iran told me that her grandparents, all in the north of Iran, where it was very hot, lived 2 floors underground during the summer. Do we think we're so fantastic at cleaning up our mess? No, we're not. In Egypt, they are much, much better at recycling. Nigeria is much better recycling than anywhere in Europe. Can we live at 50 degrees? You know, the global north says, oh, this is going to be a problem, whatever. Actually, loads of people are already living. My father worked in temperatures of 50 in the summer. He was in the Sinai Desert and everyone was saying, is that your father? He's got so many layers of clothes. My father knew to keep the temperature equitable about your body, you used a lot of layers of clothes. Wake up, Global North, listen and look around you. These are young children, the orange shirt children, who are building canals, the HIV orphans who get training over the weekend. Does anyone know where Malagasy is? Okay. They are using local materials to make light. Okay, so amazing. Look, if you look up on the internet, the number of herbs there are that's medicinal, there's over 1 billion, 1.5 billion. And then look what people do locally. This is in Zimbabwe. This is a medical camp. This is local people taking ownership, raising money themselves, a little bit of help at the beginning. They're very good at doing their own projects now. And this is their new medical center. So next slide. Okay, so what my university has a commitment to excellence. I do believe that everyone here has a commitment to excellence, and this just by working together, we could do wonders. Those are the people who were in my school when I was head of school. We do a away day when the students told us what they thought we were wanting in, and we told them the other, and we all worked together to innovate. Do not forget your local communities. Remember, innovation doesn't come when you have 10,000 images in your brain from the internet. It's when you're bored, when you're sitting out in the sun. If you look at the most innovation, it's come that way. We were already using fuelless cars 20 years ago in South Africa when there was embargo. My father's lorry went 2,000 miles across Africa on methane from debris, which they collected along the way. So look around you and give everyone an opportunity. And if we all listen to each other, work together, we could do really well. I'm passionate about this. Thanks, Prof. Alan.
Thank you for Professor Fortune and Professor Chidzonga. Are there any comments and questions to the speakers? Or would you like to add anything?
No.
No? I have a question to Professor Chidzonga. I hope it's a good pronunciation or not. I'm not sure. Sorry, Professor Chidzonga. Do you think that inequity, the use of vaccination among countries, at this point, the spread of the infection and financial inequity and social impact, economical impact, and educational impact, when we think all together, what do you think about the inequity for vaccination?
Thank you very much. Your pronunciation of my name is in order because I can quickly identify that's me you are referring to. The issue of vaccines, where the inequity comes in, is that some countries are already working on the third vaccine on their population. When we know very well, I think Africa in particular, almost like 6% are still on the first vaccination. So to me, I do not see how equity can be talked about when people are going for the third vaccine, when other people have not even got the first vaccine. And what we seem to not to realize is that if you have part of the population unvaccinated, you're still at danger. So I would like to believe that they could help Africa at least have their second dose or even the first dose. That's the equity I'm looking for. Thank you.
Thank you. Any comments and questions?
Yes. Prof. Chidzonga, I totally agree with you that there should have been more equity in vaccine delivery. And I know quite a few countries that actually paid for and ordered vaccine and then were put at the back of the queue. I think that's really important. We're never going to get rid of it. We're going to have more and more mutations. We have to have herd immunity. Herd immunity doesn't mean immunity of a small section of the world. Herd immunity means immunity for all. The other thing is, I think in Africa, there's also been a lot of vaccine mistrust because of the internet. And I think there should have been much more work actually dealing with it. I know in our area where we had a community who did not believe in the vaccine. I was just working with the community, understanding why people have a mistrust and working at their level and locally. But I do think you're absolutely right. There should have been more vaccine, but even where there's vaccine, there's very little uptake. And so I think that we as academics, people like us on this section, should go out and be dealing with the community. We should be there, we should be front facing. And I think it's a shame and a disgrace that there's been so little vaccine in Africa. But you know what, as you said, you have the capacity, you have the knowledge, you have the training. You know what? Go to the World Bank and ask them for some money. Put up your own factories and make your own vaccines. And that's the only way. When you make your own and you are independent of being somebody who you go begging to for something. Because, you know, I mean, we've got research going on, as you know, you and I are part of a project with 8 African countries. Right? And so Africa, there's fantastic research, not only in sub-Saharan Africa. I know research going up all the way through Africa. So we've got good scientists there. We have to take leadership, not be part of, all right, but lead on. Sorry,
Okay. I also have a comment actually, you know, and a question to Professor Chidzonga. I think you are quite rightly highlighted that, you know, COVID-19 is a universal problem which is being treated locally. That is to say, as a virus, it doesn't respect boundaries. It's gone all over the globe. However, when it comes to dealing with the problem, every country actually, you know, tried to protect their own interests and hid behind them, because we don't have any mechanism, you know, to deal with that universally. So do you think, in your, you know, view, that we have the structure to deal with these global problems globally rather than locally? Is that structure there and failed to deliver, or it doesn't exist at all?
Yeah, currently we have rudimentary structures. And these are the very structures that are training some of our scientists, and they emigrate when they can't proceed beyond what they've been taught. And of course, this becomes our problem as Africans and in our Africa, that we actually do not give health the necessary support, even research the necessary support that is required. So we have to be blamed for that as well. But also the rich countries have a role also to play. They are quite quick to come and extract all the wealth in our countries, but leave behind nothing behind but the dumps of what they've gotten from. So I still think, yes, we have a role to play, but the infrastructure is non-existent. And some of these countries will come after they hold the vaccine for so long. Just before expiration, maybe months before they expire, they give us as donations. And when they've got 1 month lifespan, it takes 1 month for them to get to Africa. As soon as they land at our airports, we clear them, and of course have to destroy them. So this is another side of the story, which is not fair, that they actually donate that which they don't need anymore. And when it gets to us, we can't use it. Thank you.
I have a comment.
Yes, please.
Yes, I have a comment on vaccine hesitancy, especially in Africa. I remember Sudan, when first they received the vaccine, even the medical professionals are hesitant to take the vaccines. So, and also the public still, they received vaccines and they didn't complete it. Some of the vaccine, even after 1 month, is still there is about 10% is available. So we need to address these issues with even with the professionals to increase the awareness. It's very important. And the other issue is concerning is Professor Farida about the prevention. What do you think using or resources, internet, e-learning, or awareness as a level of prevention, that it's a primordial prevention, that before we're getting the risk?
I think that's very important because we don't teach anyone how to use the internet, and we don't teach people how to be able to sift information that's correct and information that isn't. There are now really quite good programs to do that. And I think that when you introduce use of internet at school, they should be having those programs. And I totally agree with you. And as I said, part of the problem is the vaccine hesitancy. But it's people like you and I that should be much more front-facing in the communities. And here, one of our communities where I actually engaged the woman of the house. And once the woman of the house understood, then the children had it, then the husband had it, and then the older women in the community made the men have it, to the point where we got 90% coverage in a community that didn't even have 30%. So I do think you have to work on that. And you see, the problem with hesitancy is not only hesitancy, it's vaccine mistrust. And the mistrust stems from a long colonial view of health for people of color, or people who they subjugated, or people in Africa. So, and you know, I'm sure all of you know the story about syphilis. People know the story about, you know, nothing happened with Ebola until a foreign national was infected. When they were finished and treated, they all left the country, all right? And then the local people said, this is going to happen again. We have to take control, started building their own hospitals, starting getting their own vaccinations. We can do it. You know, if you look at countries, Mozambique, after the Portuguese went, there was nothing. There was not one vaccine for children. They built up that infrastructure. We've got to take control.
According to chat screen, there's a comment, very interesting comment. Many people have COVID after vaccination, so they will not trust it.
Okay. Can I take that? Or do you want to take it? Okay. So yes, we do have people. So I can tell you, I kept my center open throughout. I also worked in ITU. I don't think I've been ever so traumatized when you look down the corridor and see 40 people all looking like you, all infected with COVID. So that was a very, very traumatizing experience. And then we started having, we had 250 people in ITU. We were the biggest receiving hospital. And then that's why I worked so hard on the hesitancy and the mistrust. And then after that, there's still a component of the population who are young, politically driven, who won't have it. Now, there's two things. The people who are now ending up in ITU are people who've not been vaccinated. Yes, people who have had COVID, some of them are still getting it. but they're not ending up in ITU. You remember, we all have our flu vaccine. Flu vaccine only gives us 70% protection. The COVID vaccines give over 90% protection. If you're older, if you're taking some drugs, you won't have as good protection as someone else. So there will be people who have had their vaccines who will get COVID. We know that with flu, but we know it is not as bad and they're not likely to die with it. So it isn't a, oh, I'm not going to take it. I mean, and if you just explain to people that, you know, AstraZeneca is exactly the same as all the vaccines they had when they were a child. And Pfizer's a unique vaccine, which have only got 5 ingredients. So all the rubbish on the internet is not true.
Dr. Asim Nassar and Samir Maliki mentioned the barriers of the vaccinations regarding misinformation through social media and asymmetric information between health professionals and people. I think its time is over. Thank you for the speakers, attendees, and all audience. And I would like to thank Professor Alam Ahmed, Professor Fortune, and the other the committee members for the well-designed and very informative Congress for us. Thank you.
Thank you very much, Professor Gonca. Thank you very much, Professor Farida and Professor Chidzonga. I think it is a great work. And there was a question or comment just came before, I think the chair or the moderator closed about Africa. If you can still say something, Professor Chidzonga, is and I remember this myself as well. The Chinese, they were trying to help Africa and they built a vaccine factory in Cairo, in Egypt, sorry, out of Cairo. And they said this will help producing vaccine for Africa. Do you have anything to say on this? Is it working? Is it just now reaching other African countries, or?
I'm not aware of the vaccine factory in Egypt. No, I have no idea.
That's where it's interesting, because they said they did it for Africa, but it's interestingly no one knows where they're producing.
Yeah.
But that's fine. Thank you very much, Professor. Thank you very much. Excellent session. Now, I would like to move to the concluding remarks by a well-distinguished academics, because most of us are academic, but also a politician, highly respected politician and academic. It's very difficult. When I remember earlier, Adil was talking about leadership. So here we have an academic who is a good leader. But Gale Rigobert, she's an academic like us with the University of West Indies. She's a Cambridge graduate, as well as studying in the Caribbean. But she has been a very strong vocal voice across the world. The United Nations referred to her many times because she's campaigning for climate change, for global good. In Paris COP, if you remember, I remember her statement on BBC on 6 o'clock news to the whole United Nations, saying to them, if you don't do this now, by 2050, those islands will not be affected, but they will disappear. So she was warning the world 5 years ago that countries will disappear, so we will not see them, the islands. I traveled to some of these islands, St. Lucia, and I remember that's the most, I don't know, frightening flight I have ever had in my entire life, because the flight flying from London, as it come closer to Port of Spain, I think it couldn't land, then it has to go up, then it landing, and then it has to go to St. Lucia. The flight was so you can see how the hurricanes and the climate change is affecting. But she is a very much advocate of ICT. She herself, I showed you the book before. We are very pleased with what she has done. She's a very, I don't know what to say, very stimulating speaker herself. But one of the quotes I would like to say, I'm listening to her one time. She said, we want our teacher in school. We don't just want to give teachers or kids computers, but we want the teachers to understand how to operate the applications and the computer itself. I think that's exactly what developing countries need. It's not just we give them computer, but we need to make them able to understand so they can use this technology or this computer. So without further ado, her work in WAS, of course, is remarkable. Dr. Gale advises us generally and more specifically on issues to do with the organization itself. She was the advisory board, and shortly this advisory board is going to be enlarged. And I hope she will continue to play her critical role in this advising WAS, because she has both of the developing countries, the Caribbean, the islands, the West. Professor Gale, I don't know what to say, but the floor is yours, and we're looking forward to listening to you.
Thank you, Alam. Thank you, Alam, for that, Professor Alam Ahmed, for this very gracious introduction. It is so good to see many of you whom I would have met in person previously, and some of you, of course, I'm meeting for the first time via this medium. It was such a joy as well to listen to Professor Farida, who I've known for a while now, and the extent to which 15 years on or more, we are at this because at the root of the discussion over the past 3 days is the issue of inequality. And so with that being said, let me thank you, Professor Ahmed and colleagues, for hosting such a significant, apt, important conference. COVID-19 has disrupted life as we knew it prior to 2020 in the main, but we must of necessity view this disruption with Schumpeterian eyes and ascertain what opportunities have been created because of COVID-19. Within the context of today's conference, yet again, global leaders, policymakers, academics, consultants convene to determine the role that universities can play in 1, normalizing SDGs, 2, integrating SDGs into existing or evolving policies, 3, mainstreaming SDGs such that they are not seen or viewed as some abstract, unreachable set of goals, but rather they become a key staple in the exercise of policymaking. Ensuring the SDGs undergird the practices of universities. For example, by infusing renewable energy, smart technologies in their infrastructure. And in this regard, they will be viewed as leading the charge from the front, leading by example, well beyond motivating universities to embrace the SDGs as a critical topic worthy of being infused into the curriculum. The additional role of advocacy is critical, is essential. The world still expects universities to provide the inspirational and transformational leadership. Hence, universities ought to ramp up their evangelization, their advocacy on SDGs. Regrettably, SDGs are still viewed in many quarters as some abstract, unreachable, utopian set of goals. For example, in the ongoing discussion about vaccine inequity, there has been little to no debate or acknowledgement that vaccine inequity is in fact a function of a systemic problem, systemic inequality, systemic inequity, which is reflected in every facet of life, more recently with respect to vaccines and the distribution of vaccines and access to vaccines. Moreover, while there are 17 SDGs, defined and structured separately, we needed to recognize the indivisibility of SDGs. Hence, any discussion of SDGs should revolve around the cross-cutting themes, issues, and hence cross-cutting solutions. It is no coincidence, therefore, that goal number 17 emphasizes partnership. Our ambitions, therefore, should be informed by this inherent nature of the SDGs, which in fact mirrors what obtains in the international political economy. This is particularly evident, for example, by the range of topics covered over the last 3 days. Universities, therefore, in responding to this reality, are being forced to become more nimble, more malleable, more collaborative, both by enhancing interdisciplinary relations and forging more partnerships between and among universities and the private sector, including strengthening relations with civil society organizations. It's for this reason I am so excited about what we have been able to initiate by hosting this conference. In effect, setting in motion the mechanisms and establishing the platform for us to realize in a very meaningful way the synergistic gains to be had when we endeavor to work together for the common good. This is a necessary pretext, a necessary precursor to triggering the paradigmatic and systemic shifts needed to correct the institutionalized and systemic inequities that pervade the international political economy. So whether it be by employing ICTs to improve government's delivery of services and goods, a la e-governance, or embracing ICTs to improve the bottom line of companies and businesses, hence e-commerce, and very significantly positioning countries, institutions, and individuals, entrepreneurs, to capitalize and give new meaning to an encouragement to the spirit of entrepreneurship, but for humankind to experience the gains promised in the SDGs, we must do the following. One, we need more aggressive marketing and advocacy. And by that I mean mainstreaming of the SDGs. Greater effort to correct the notion that the SDGs are of concern to people like us in exclusive spaces like this, and instead have SDGs become part of our everyday parlance, where ordinary people, the global citizenry, understand the SDGs, embrace the language of the SDGs, and appreciate their individual role in realizing or meeting the SDGs. The global citizenry must be able to identify with and appreciate the SDGs, which should then inspire them to do their part in ensuring that the SDGs meet the ambition etched in the fabric of the language of the SDGs, that we can truly experience the spirit in which the SDGs have been enshrined. In so doing, the conversations we've had today over the last 3 days on e-government, digital education, gender, income inequity, impediments to realizing SDGs among youth and women in particular, the significant role of big data and artificial intelligence, the need for strategic planning, the pandemic, inequity and inequality, and interestingly, making sense of the knowledge environment in the emerging context. All of these, to my mind, stem from the fundamental issue of inequality and inequity embedded in our global capitalist system. Curiously, it is the same system and the institutions that are in the main a caricature of the system that are now charged with resolving, reconciling, and curing these systemic asymmetries that breed the inequalities and inequities that pervade every facet of our lives. And that is why accomplishing the 17 SDGs is no easy feat. We are swimming against the tide, but it is laudable that the champions of change, our global community, the United Nations and its affiliate organizations, universities, CSOs, NGOs, INGOs, that we are undertaking what is expressed within the architecture of the SDGs. And we must applaud all who are involved in that endeavor. And we each have a critical role to play. We need 1, strong moral leadership, 2, change agents, 3, a global population that buys into and embraces the SDGs. 4, adequate financing to allow for a meaningful pursuit of the SDGs. 5, we need also champions, visionary champions for SDGs so that they become a household ambition, which then find expression at the highest levels. But there is much reason for us to be hopeful. Forums such as this one can go a long way in highlighting the significance of the SDGs and provide a platform for the necessary dialogue. The United Nations and sister agencies have exerted much effort and invested significant resources to ensure that the SDGs are a success, or rather meeting the SDGs become a success. Already, notwithstanding the significant challenges to be overcome, there are success stories and gains being made, albeit incremental. The dialogue and action around climate change, regrettably slow, but moving nonetheless. The strides made in the exercise of greening our economies, with countries articulating their ambitions with respect to reducing reliance on fossil fuels and the uptake of renewable energy, regrettably not at the pace that is necessary to reverse or stem the effects of global warming. But evidently, to the extent that we are discussing this at all, at every level, is instructive. Technology gaps, digital gaps continue to haunt too many societies. And we've heard the stories today. We've seen some of our colleagues experience this firsthand today. Goal number 9 in particular references industry, innovation, and infrastructure. Presumably, this is geared towards not only narrowing the various technology gaps, but also better positioning countries to maximize on or capitalize on the benefits to be had. So I must therefore say that I always find it very curious that the word inequality, the concept of inequality, finds expression in a handful of goals, whereas it is, to my mind, the overarching pervasive issue. And that inequality or inequity give rise to the disparities and the gaps that we are now endeavoring to cure as articulated within the language of the SDGs. It is no coincidence, therefore, that education is emphasized as the bedrock of the ambition enshrined in the SDGs. Further, this is precisely why this conference has focused almost exclusively on the role of universities. This conference is a clarion call to universities to assume a lead role in championing the value of the SDGs and the need for other agencies in the international system to play their role in advancing the SDGs. Governments, public and private sectors must see themselves as critical players and stakeholders in ensuring that the SDGs do become a success. Of particular note is the need for finance to ensure that the SDG agenda is not starved of resources, but the endeavor is very well resourced so that the intended benefits or the intended beneficiaries of the SDGs can really experience the curative, progressive, and overall benefit to be had. The emerging educational knowledge environment is one that allows for perhaps previously unseen levels of collaboration. It is no wonder we see a plethora of transdisciplinary institutes at many universities around the world, marrying the capacity of actors in industry, academia, government, and civil society. The advent of this level of collaboration is absolutely necessary to facilitate a comprehensive, multifaceted response to the complex global problems that confront the world. I therefore end by lending my own voice to the call for universities and institutions of learning in the main to claim their rightful place at the table and to ramp up efforts to address the problems that beset our world. Today's conference tells me that we are off to a great start. Let me again congratulate all of you for playing your role in championing the response, the effort required to, in effect, level the playing field by addressing the inequality and inequities articulated in the SDGs with their commensurate prescriptions for change. Your effort, to my mind, is a significant propeller for change. I thank you for listening.
Thank you very much, Dr. Gale. I think we should draw it for you, although there is a virtual hand, but let's do it real one.
Yes.
Thank you very much, Dr. Gale. We are very honored to have you. And before I forget, actually, was over the last many years, there are many people who are also in the senior policy leaders, if you like. We have the Minister of ICT from Uganda, who recently, I think, then became the Ugandan High Commissioner in Canada, in Ottawa. He came to 2 conferences in Brighton and also in Bahrain. And I remember very famously, he was advocate of ICT. He said the voters in Uganda who they keep voting for him, he was trying to help them. And therefore, he said he went to the Silicon Valley and said to them, can you create a computer which work with normal batteries? Because the people I want to get this computer to in Uganda, they don't have electricity. So you can see how we still have, despite the high level of corruption in many developing countries, but you also have senior politicians thinking seriously about helping their voters. We also have the Tunisian Minister of Sustainable Development, who also happened to be the Vice Chancellor of the university who also was an academic in Tunisia. We have a very good relationship with him. He also came to London 2019. So what I'm trying to say, we also have many ministers from Sudan. We had the Minister of Higher Education, the former one, and others who are involved with Sudan. Yes, the same thing from Middle East. So we are very happy if any country is keen on WAST advisory services to help them. We are very happy to let them, to connect them with people like Gale. tremendous experience. Yes, this is something is available, and it can be also being facilitated through us. You can hear from politicians who are actually highly, if you like, experienced, and they have been there. So that one is said. The other thing, just some few logistic before I introduce few people. Number one, when we finish, those who complete their papers for this conference, we will take them further into the World Sustainable Development Outlook 2021. And this outlook, as I said, is becoming very famous. All universities, even I remember at Sussex, I did not give a copy of that 2007 to the library, but suddenly my students told me it is in the library. So the university bought it, and I said to the librarian, you should have asked me, I could have given you a free copy rather than you buying it from the Greenleaf. And she said to me, Alam, we normally go through a system. So the system in universities in the UK, and I would assume all over the world, for your book to get into the library is extremely competitive because there is no space. But I'm very pleased to see our outlook is all over the world, in Cambridge, Oxford, London, Strathclyde, any university. Even I have seen it in South Africa, in Botswana, in UAE, in China, in Turkey, many places. Most of the American universities, Chicago, MIT, I think I'm also sure this is in Yale University. So I will encourage you. Those who they have just submitted abstract and they want to catch up, we give them the opportunity, but they have to develop the papers quickly. Now, all this and the TV production we do, plus everything we do here at WAS is a huge work done. And we have proven to the whole world that this can be done virtually. We've been working virtually for many, many years. And let me start introducing you some faces. I have never met them in life, but they have been the backbone of what is happening here. Let me first, if I can ask, yes, Suhail Zaid. Suhail, can you show on camera, please? Suhail, the same like Mervin, he has been going through challenges at home with COVID as well, but he was still helping during the conference. Those are the real people who are actually doing lots of work behind the scenes. Suhail, we give you the chance to say a few words if you want, Suhail. Suhail is doing all of the graphic work. We have many graphic designers, but he is the lead here. And the good thing is he can do 3 languages, Arabic, English, and French. So we are very pleased to have 3 languages. So anything we can do in this. Suhail, you can say a few words if you like.
Thank you so much, Professor. Thank you for all the professors and doctors. And we are looking for the great conference in the future. Thank you so much.
Thank you very much, Suhail. Let me see who else is here. I contacted Naveen Joseph, who is in India, but he said he's in church, but he will try to say hello to you. This fantastic work is done on the production side. Is also being led Joseph, Naveen, and his teams in India. They've been doing WAS work from 2007. So we became friends. So many times we send messages, we don't even say good morning or hello, we just shoot each other. So these are great people working far away, doing this fantastic work for many organizations. Let me see if Komar is here, because the beauty of what you see in this website, we just keep pushing things. Can you do this, Komar? Can you do this song? And he do it. He's an extremely smart guy. Where is, yes, Komar, do you like to show him camera, Komar?
Yeah, actually, the room is all messed up. That's why.
No problem. Just we are very grateful for your support, Komar. Just say few words. The people are now listening to you. You are behind this great web development.
Really, thank to you for giving me the chance to work with you, and I hope we can continue with in future as well with a very long term. And I will try my best to give you the best work, whatever I'm good at.
Thank you very much, Komar. Komar is very smart. All we do now, we just send him idea. Komar, can you do this? And he say, okay, let me think. He comes back with idea. And even this TV, I'm very proud. The TV channels we are now using, it is his making. Interestingly, I looked into many actual TV channels, which are commercial. They don't have a TV channel like this. So our all videos now, it's just now we're looking for funding so we can employ people, even volunteers, to upload those videos. You know, each one of you across the whole world, we have thousands of experts joining us. we really want to have a dedicated playlist for every single person. And also the second step is to have every video attached to the talk, to the paper, to the chapter, and everything. So it's a complete knowledge, if you like, hub. But now, people like Omar, they made the technology to work for us, and we tested it. It's working now. It's just now we need to have huge amount of hours. So we really also are looking forward to people who can help us financially to employ people to do it. And I'm sure you have seen Mervin. Let me just see if Joseph here. Joseph, I don't think I'm seeing Joseph here. But anyway, it's a huge work. Many people are helping us. And also here, I praise other people who many times they contact me, Alam, what can I do? I want to help. We have many people in the past help. Normally, we in the conference, we ask them to come forward so people they can see them. So I would like to kindly ask you all if you can show him camera so Mervin can take group pictures before we close this conference. So don't worry about your background. Just come. Let's take this. You never know. I mean, we had a picture in UAE 2005. Then some people contacted me. They said, "Oh, this is the Nobel Prize." I said, "Yes." You didn't believe us when he was in Abu Dhabi saying. So you don't know how these people are going to end up. So make sure you get into the picture.
Coming online?
Anyone would? Can you show on camera so we can take the picture? Oh, I can see Komar here on the left. Yeah, I think Joseph came. Let's just take Joseph with us, Mervin. Thank you. Joseph.
Yeah, Joseph.
Where is Joseph?
Joseph, sir?
Joseph? Naveen? I just saw he's coming on Naveen.
Shy.
You saw him, right?
No, I say he's shy.
He's shy.
Okay.
Joseph is one of the, I think in his area, he's one of the leader, really. He's in this online publishing. Joseph, I have seen you on, maybe I am wrong.
Yeah, I don't see him on the list now.
And we're hoping in the nearest future, people like Joseph and also Suhail, Komar, I think he's coming now. We want them to help developing countries, teaching them how to do this as startups. Imagine video production. And video production in particular is very important. So Mervin is doing the graphic work, the web development. These people are very professional and we want them to teach others in a reasonable way. Joseph, can you? Oh, he's here, Joseph.
Okay.
Joseph, yes. I was just talking about you, Naveen, and I said you being behind WAS publication for many years. I don't want to sound you are old, but you are still young. I can see you. So, Joseph, thank you very much for all your help. There's a lot of people. Some maybe you have worked on their papers many years ago. They have never seen you. They don't know who was doing that great work. They think it's me, but it's not me, it's you. Right. Can you say a few words before we close, Joseph?
Could I take this picture first, Alan?
Okay. Yeah, let's take a picture again. Take the picture again. Can you all show on camera, please? Can you all come back on camera?
Okay, thanks.
Okay, Naveen, floor is yours. Thank you. Sorry for interrupting your church.
Okay, it's okay, sir.
So we're giving you, say whatever you want to say to those people from all over the world.
Yes. It is very nice. I mean, almost from 2007, we are working together with Dr. Alam and, with WAST. And we started all the journals, typesetting, designing, and, editing a lot of books. So very happy to working with the authors and editors, especially with the Dr. Alam. So I look forward to working with you again. And also, as per the WAST concern, in the future, we would like to look forward for the going forward. We would like to move with a digital format of books, so that journals and books can be available in Amazon, Google Play Store, Apple Store, and all other online sales stores. You can find vast publication thereafter. And also I have a plan, I will discuss with Dr. Alam. We have a new technology called, in US is a new technology called PDF accessible PDFs. So PDF accessible is mainly for disabled people. And we also have a plan for this PDF accessible formats for the users, those who are disabled, so they can listen or they can see their books. So this is what our future digital plans.
And Joseph, I know for many years, Joseph, he doesn't complain, but normally when he sent for correction of his team, some people, academics, they respond quickly, 1 or 2 emails. But some people, he said, they cost him many emails. So the Mac, just give us example of a most difficult author who takes so many emails and still he doesn't give you what you want. How many emails do you have to send with an average or the difficult one?
No, I mean, only I found it 10%. It's very difficult to communicate to them. Otherwise, 90% it's very easy to deal with authors, honestly, because apart from WAS, we have worked with many other publications, there we found it's very difficult with a lot of it. But here people are very respectful and, immediate responses, and even they are very, hectic schedules. They immediately get back to us with the response and all. So very good working with them.
Thank you very much. Yes, I know you're trying to be to be as nice to us, but please, those people, they really, when you don't respond to their emails, it delay the whole thing. Joseph, Janet is not here. I hope she was also, how many of you. Now, Farida, I will give you just a final word if you want before we say goodbye, because you have been putting quite a lot of effort, and you were keen originally to host it in your premises, which now, not thanks to COVID, but we were not able to do it. Farida.
I would just like to say thank you to everyone for a brilliant conference. Like Alam, Prof. Alam, I'm very sorry we couldn't host you, but the invitation's open, and the next time we can all meet face to face. We'll meet face to face in London and host you then. So thank you, everyone. It's a huge learning, this conference, and every time we have one, we meet new people. We meet old people who we've known, and everyone comes with a fresh perspective. And that's the good thing. This is a fantastic network. You don't have to be dependent of just your academic position in your university. Together, we could do a lot. And so I think one of the things is we should think of doing our own projects. With so many people, we can always apply for money independently, because until we do things ourselves, right, nothing's going to happen. If we're tagging along behind someone else, the resource will always go to them. So yes to a bright future, and thank you so much. And thank you, Alam, Prof. Alam, because I know you and Mervyn is a star because he's not well. And it's taken quite a lot for him to be here, and so I applaud him. So have your vaccines so that we don't all get ill, and we'll meet again soon.
Thank you very much, Farida, and we say goodbye. I can just see quickly in front of me, UAE, Uganda, UK, Turkey, Zimbabwe, UK, Uganda, Algeria, UK, India, I think this is UK, Nadia, I'm not sure where, Al-Jizuli, UK, Shashista, Pakistan, I think Okan is Turkey, Saudi Arabia, Malaysia, Sudan, Where else? UAE, San Lucia, we have UAE, Turkey again. So it's a huge, nice meeting all of you from across the world. We finish here. Thank you very much. And please accept my sincere apology and all our sincere apology. The timing has to go this way. Otherwise, from the lesson last year, it will have been very difficult to compact it all after each other normal session. And also sincere apologies for those which we could not take their papers, because the problem with the online conference of 3 days, you can't have, because in the normal face-to-face, you have better sessions. Here, you can't have it. You can have it, technically you can, but it will not work. Imagine you are watching here, someone is watching another room. It's not possible. So we try it, and we also try to have a diversity, but hopefully next year we will see you all. We don't know where, but we will work very hard. Maybe a country will become, I don't know, COVID-free. We will go to that country, but the problem is how we're going to travel to that country. It's not going to, but let's hope. So anyway, I say goodbye. Thank you very much for all your time. All the best. We will follow up. Everything will be on the website. All the best. Bye-bye.
So please remember, if we all help and do a little bit, it will make a big difference.